I got a tip. 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 Hey, Tip Thursday, Tip Thursday, Tip Thursday, Tip Thursday. Hey y'all, it is Tip Thursday. And every Thursday, starting today, I will be giving you tips on how to succeed in nursing school and how to pass the NCLEX exam and how to be an awesome nurse. So today's tip is going to be about clinicals. So today's focus is going to be about not just showing up for clinical, but showing out. And I know how y'all feel about clinical. Y'all feel like y'all working for free, which it is, but you are investing in your learning. So I got just a couple of tips about how to stand out and show out in clinical. So number one, you want to show up early. Now I'm not saying getting there an hour early, getting there before the instructor get there. No, I'm saying if your clinical starts at 6 o'clock, hey, get there 5:50. You know, just a little 10-minute earlier, being that when it starts at 6, you're not putting your book bag up, like you're ready to go. Speaking about being ready, let's have all your materials. Let's have your stethoscope. Let's have your pen light. Let's have your clipboard. Let's have all your necessities that you need for today. Another one, have a pair of scissors. Have scissors and tape, y'all. Come on, let's be ready. All right, dress professionally. Y'all, I know we've been getting a lot of heat about being aesthetically pleasing and all that kind of stuff like that, but I'm telling you, you want to be dressed professional. So that means iron. Let me say it again. Iron those scrubs. And if you don't have an iron, throw those things in the dryer to get the wrinkle out of it. It's just something about a nurse that looks good that, you know what, girl, you look good. I know you know what you're doing because you look good. So you just always want to look the part. You know, make sure that your hair is, kept, pulled back, whatever. Just make sure that you looking good, 2, take ownership of your learning. Y'all know the skills y'all got to get checked off of in order to pass clinical. Seek out those opportunities. So you know you need to get checked out on IVs. Don't just wait for the clinical instructor. Be on the unit. Ask them, hey, anybody got an IV? Anybody need this done? Take ownership of your learning. Another thing is that you should not be afraid to ask questions. I think the greatest nurse and the greatest nursing student is a student or a nurse that doesn't have too much pride to ask questions. Always ask questions. Before you make a mistake, ask questions. And that's a part of taking ownership of your learning. Number 3, own your mistakes. So guess what? You're going to make mistakes. You are a student. But the difference is when you own your mistakes and you're willing to admit them and, learn from them and, grow from it. So don't let, one mistake just hold you up. Admit like, hey, I should have assessed my patient before I did this, but I didn't. But in the future, I know. Number 4, be confident. Y'all have to be confident. Even though you scared, you still have to be confident. Your patients can tell that you're not confident. And all patients are not going to allow you to be their nurse just because you're a nursing student. Like, it don't work like that. So it's up to them, so you want to exude confidence. And number 5, you want to go the extra mile, y'all. When I mean telling you going the extra mile, meaning, if you only got 2 patients, help the CNA out with her vitals, helping the nurse out with anything that she needs. Going the extra mile. You're not sitting around in clinical. You're not sitting around. You staying busy. Like you asking, you asking your classmates, do they need help? Like you just going the extra mile. You taking care of your patient, but you taking care of somebody else's patient as well. And the thing about it, when you go to these clinical units, 9 times out of 10, those are going to be the same units that you're applying to when you graduate. And when you go to clinical and you not just show up, but you show out, guess what? They remember you. And sometimes you can even get a job offer while you're still in school because they see that you just that girl or you just that dude. So these are my tips for how you don't just show up to clinical, but show out in clinical. No, it's not a competition. It's not a competition. But you want to think about this, that the nursing new grad job market is a competition. So I just want you to think about that. The next time you go to clinical and you're not really feeling it, you want to think about it like, hey, I got to not just show up, but I got to show out. See y'all next week for the tip. And that is this week's tip. So don't just show up to clinical, show out in clinical.